Yellow fever is of importance in Nigeria as part of global efforts to eliminate yellow fever epidemics. Nigeria, with a population of 200 million, has roughly about 160 million people at risk of yellow fever.
Yellow fever is dangerous because small percentage or small proportion of patients will go through a more toxic phase of the disease. By then, they will experience fever, they will have system failure, like mainly in the kidney and also in the liver.
The effect of yellow fever is not only to people, but also to a shock to the health system and has very huge economic impact as well. Because like we know, there is no treatment for yellow fever.
They may experience bleeding coming from the mouth, the nose, and also the eyes. And within those patients, within 7 to 10 days, half of them will die.
So we focus around the issues of prevention, and the yellow fever vaccine is a very important tool towards preventing this.
The Eliminate Yellow Fever Epidemic Strategy looks to protect about 1.4 to 1.6 billion people in Africa and in Americas who are at risk of yellow fever. And the key components of this strategy really are to protect populations from yellow fever, to respond very quickly to outbreaks, and of course to prevent international exportation of yellow fever from various affected countries in line with current IHR regulations.
What the I strategy has done, and the Secretariat, has raised yellow fever as a real global problem following the outbreak that happened in Angola in 2015-16. This has allowed for increased production and availability of vaccines. It's also increased the ability to test and detect yellow fever in order for us to provide some resources towards interrupting outbreaks when they happen. So we have labs, laboratory diagnostics that have been able to pick up these outbreaks early enough for us to be able to interfere.
But more importantly, within Nigeria, yellow fever is an important public health challenge for the country, and the country is rising up to meet that challenge, working with partners and in alignment with current global efforts to eliminate yellow fever epidemics.
The campaign for yellow fever in Nigeria, and now that we are in Taraba State, was a collaboration between several partners.
It's not only a Gavi affair, it's also a world affair, because when the World Health Organization point out a disease which needs to be eliminated, controlled, or eradicated, that one is part of our mandate to support that activity.
UNICEF is a core partner in I. So UNICEF at all levels supports the planning and implementation of activities that are meant to address the issue of yellow fever in Nigeria.
Our main concern is to procure the vaccine and also to support the operations of the vaccination through WHO and through UNICEF, for giving the needful for reaching all these hard-to-reach populations.
What we do is we make sure that the vaccines come into the country. We also make sure that the vaccines go to the implementing states.
Our support over the years has been for data management. So what we do is we ensure that once this country is ready to implement and they begin the process of planning, that the states are ready for implementation. So we take them, we begin to track the process of readiness through the pre-implementation phase of the campaign, because it's not just to get vaccines and take it down and then the state is not ready to implement. So we ensure that those activities at the state level are completed and the states are at least above 80% readiness to implementation.
People that are in this community have welcomed it based on the sensitization and enlightenment that have been taking place before the inception of the vaccination activities. So people have welcomed it.
The reaction I usually got from the communities are actually positive reaction.
So we're being lectured by the Director of Health. He gathered us and lectured us that this is of great help, not only for yellow fever. Measles used to destroy so many lives.
They are very happy to receive the vaccine. They didn't complain about pains. They are just ready, they are in line, taking the vaccine with happiness.
The vaccine for yellow fever is a highly effective vaccine. One single shot will provide long life protection. What the vaccine does is that it exposes you to a small sample of the virus, and this will allow your body to trigger immunity and protect you against the disease.
So I believe that taking this injection, when yellow fever comes, it will not affect my children again.